Type 2 diabetes is a growing health crisis worldwide. It affects millions of people and costs billions in healthcare expenses. The World Health Organization reports that around 422 million people have diabetes, with type 2 being the most common. This condition is characterized by high blood sugar levels, which can lead to severe complications. These include heart disease, kidney failure, and nerve damage. Recent studies show that the number of people with diabetes is rising. This increase is linked to lifestyle factors like poor diet, lack of exercise, and smoking. Smoking, in particular, has been identified as a significant risk factor. Despite this, many people are unaware of the connection between smoking and diabetes. They continue to smoke, unaware of the damage they're doing to their bodies. The global prevalence of type 2 diabetes is alarming. It is essential to understand the factors contributing to this epidemic. By addressing these factors, we can develop effective strategies to combat this disease. One crucial factor that needs more attention is smoking. Recent findings have shown a strong link between quitting smoking and a reduced risk of developing type 2 diabetes. Studies indicate that people who quit smoking reduce their risk by 30 to 40%. This reduction is significant and highlights the importance of smoking cessation programs. These programs can play a vital role in preventing diabetes and improving public health. The connection between smoking and diabetes is becoming clearer. When people smoke, they expose their bodies to harmful chemicals. These chemicals can damage the pancreas, the organ responsible for insulin production. Insulin is a hormone that helps regulate blood sugar levels. When the pancreas is damaged, it can lead to insulin resistance and, eventually, type 2 diabetes. Smoking cessation is a powerful tool in the fight against diabetes. By quitting smoking, individuals can significantly reduce their risk. This benefit is not just limited to diabetes, but extends to other health conditions as well. Quitting smoking improves overall health and can add years to a person's life. The message is clear. Quitting smoking can save lives. It can prevent the onset of type 2 diabetes and other serious health issues. Public health campaigns need to emphasize this connection. By doing so, they can encourage more people to quit smoking and lead healthier lives. Nicotine, the addictive substance in cigarettes, has a direct impact on the pancreas. The pancreas contains VE cells, which are responsible for producing insulin. Nicotine can damage these cells, leading to reduced insulin production. This damage can result in higher blood sugar levels and increase the risk of type 2 diabetes. When nicotine enters the bloodstream, it affects the pancreas in several ways. First, it can cause inflammation. Inflammation can damage the V cells and impair their ability to produce insulin. Second, nicotine can also lead to oxidative stress. This stress further damages the cells and disrupts their normal function. The combined effect of inflammation and oxidative stress can be devastating for the pancreas. The damage caused by nicotine is not limited to the pancreas. It also affects other organs and systems in the body. For example, nicotine can increase blood pressure and heart rate. These changes can lead to cardiovascular problems, which are common in people with diabetes. Thus, the impact of nicotine is far-reaching and harmful. Understanding the biological effects of nicotine is crucial. It helps explain why smoking is such a significant risk factor for diabetes. By damaging the pancreas, nicotine disrupts the body's ability to regulate blood sugar levels. This disruption can lead to insulin resistance and, eventually, type 2 diabetes. Section 4. The call to action. Policy changes and personal decisions. The evidence is clear. Smoking is a major risk factor for type 2 diabetes. To combat this, we need to implement effective policies and encourage personal decisions to quit smoking. Governments can play a crucial role in this effort. They can enact policies that create smoke-free environments and restrict tobacco advertising. By doing so, they can reduce the prevalence of smoking and its associated health risks. Public health campaigns are also essential. These campaigns can raise awareness about the dangers of smoking and the benefits of quitting. They can provide resources and support for those who want to quit. By making these resources accessible, we can help more people make healthier choices. Individuals also have a role to play. Quitting smoking is a personal decision that requires commitment and support. There are many resources available to help with this process. These include nicotine replacement therapies, counselling, and support groups. By taking advantage of these resources, individuals can increase their chances of quitting successfully. It's time to take action. We know that quitting smoking can significantly reduce the risk of type 2 diabetes. We need to use this knowledge to inform policy decisions and personal choices. By doing so, we can improve public health and save lives. Section 5. Conclusion. A healthier future without smoking. In conclusion, the connection between smoking and type 2 diabetes is undeniable. Smoking increases the risk of developing this disease by damaging the pancreas and disrupting insulin production. However, quitting smoking can reduce this risk by 30 to 40%. This reduction highlights the importance of smoking cessation programs and policies. We must act now to address this issue. Governments, public health organizations, and individuals all have a role to play. By creating smoke-free environments, raising awareness, and providing support, we can help more people quit smoking. This will lead to a healthier population and reduce the prevalence of type 2 diabetes. The fight against diabetes is ongoing, and quitting smoking is a crucial part of this battle. By understanding the connection between smoking and diabetes, we can make informed decisions. We can implement policies that protect public health and support individuals in their efforts to quit smoking. Together, we can create a future where smoking is no longer a major risk factor for diabetes. We can reduce the burden of this disease and improve the quality of life for millions of people. It's time to quit smoking and beat diabetes. The benefits are too significant to ignore.